Adua TV, bringing good things to life.
All right, thank you very much for joining us once again. I am here with Ben. Ben is with the Anglican Health and Community Network. They connect, prepare, and equip Anglicans to provide health care, accompany the sick, and advocate for equitable health care. Well, nice speaking to you, Ben.
Thanks very much for having me. It's great to chat to you.
So, tell us a little bit more about what you do with the Anglican Health and Community Network. I know once I've seen health there is something to do with supporting people with health needs.
Yeah, absolutely. Well, our aim is to support and equip the Anglican communion to provide healthcare, but also to advocate for equity in healthcare, because we see it as a part of the biblical mandate on our lives as Christians to be advocating for justice in healthcare, but also we know that around the world there's a lot of Anglicans involved in healthcare, and we want to support them, enable them, help them to build bridges with governments and civil society organisations and other kinds of partners, because we know that the Anglican Communion can be a really important and strong actor in improving healthcare for so many people. So we do that. We've done World Health Organization briefings, especially around COVID, to support getting that information, trustworthy information out there. We've also been involved in doing lots of different kinds of kind of cross-border malaria initiatives, especially in Southern Africa. And we also have kind of communities of practice. So we've had them on mental health, and we brought together Anglicans from all over the communion to discuss the issues in health that matter to them most.
So that is actually a very impactful project you are doing. How long has the Anglican Health and Community Network been in existence?
Well, we only officially started on World Health Day in 2021, so we're not that old. We're fairly new. There was a previous commission, and there's been lots of work building for several years. But the launch of this specific new Anglican Health and Community Network is only since 2021. So we're just getting going, really. Our hope is to gather more people, more Anglicans across the communion who have that passion for healthcare, but also might be involved in providing it themselves, to work together, because we know that actually we can do an amazing amount when we're able to collaborate with one another.
This is very beautiful. And you are working with the church directly, or you have very different visions from what the churches do?
Well, no, I think our vision is to support the churches. The churches are the ones who are on the ground in communities. We care about community provision of healthcare, because we know that things like primary healthcare at the very lowest level, those can be the most powerful tools for increasing equity and access. So our hope is to be able to support the churches in doing that, to ensure that churches can become health promoting, but also in times of crisis and difficulty, it's really hard to get trusted information and knowledge, isn't it? And so we want to support, through having those partnerships and connections, to get that information to people so they know who they can trust. Because does that make some sense?
Yes. And so how wide is this network? Are you just based in the UK? Are you all over the place in Europe, in Africa, in Asia, even in America, or you're just based in the UK?
Well, so we have three conveners. They're the people that head up the organisation, the network. One of them is the former Bishop of Namibia, Luke Pato. There's also Janice Sang, who's an oncologist in Hong Kong. And then we have the Bishop of Bath and Wells, Michael Beasley, who is the other convener. And then our other coordinator alongside me is Sally Smith, who's a World Health Organization expert. And our aim is to branch out well beyond the UK. We're based all over, in a sense. Because we're just getting going at this early stage, we're looking for partners everywhere. So we had an international consultation a few months ago, and there were people from all over the world at it. And we've had briefings again with people in lots of different places, from the Solomon Islands to Colombia. We've been inviting people to join in with what's a really important mission for us all.
So what do you seek to do with the Lambeth Conference? It's a big platform. a lot of bishops here, spouses, and other clergy. What do you want to do with the Lambeth Conference as far as your network is concerned?
Well, we've got 2 seminars. One was on Monday, and that was on trust and vaccines and COVID. And then we've got another seminar which is coming up tomorrow, which is on the other pandemic, and that's about global mental health crisis. So we've got experts from around the world speaking into those seminars. That's our kind of key support for the bishops. But we've also, our hope is to, by being here and introducing to people our aims and our vision, actually to invite them to shape it. Because if it's just UK based, that's not going to be helpful, is it? So our aim is to actually invite the bishops from all over the world to decide what this looks like. What are the issues that they care about in health? What are they seeing? And how can they use this kind of network?
Okay, I understand you've been to Ghana as well.
Oh, I absolutely love Ghana. Yeah, I did my doctoral work. One of my case study was on Ghana, so I spent quite a bit of time in Accra, and I am a big fan of Ghana, and I love Accra. It's a wonderful place to be, especially working around the university and with lots of different people around. I love the church as well. I love being in church in Ghana because I think.
What church did you attend?
Do you know what? I can't remember the name of it. I did Ridge Church. I did go to Ridge Church. I definitely attended Ridge Church. I went to a few different ones because I wanted to see the kind of diverse expressions of church in Accra. Because, do you know, one of the things that, in churches we get so used to our own way of doing things? One of the most special things about being in Ghana was I got to see how many different kinds of Ghanaians were worshipping. There was one church I went to where they started, not only did they have Bible studies starting at 8:30 on Sunday morning, they'd met every night in the week to pray over a particular issue, and then they were worshipping for hours on Sunday, and I thought, that's really inspiring. I really enjoyed that. So, it was good fun.
Thank you very much for speaking to us, Ben. We hope to meet you some other time and speak more about the Anglican Health and Community Network. Thank you.
Very much.
All right. So that was Ben, and Ben is with the Anglican Community Health and Community Network. They are actually trying to spread across the whole world. We would move on to another institution. Thank you.
Adua TV, bringing good things to life.